Welcome to Evidence Based, a new Harbinger psychology podcast. I'm your host, Cassie Stossel. On today's episode, we're talking about healing trauma for Asian Americans with Dr. Helen Su, author of the Healing Trauma Workbook for Asian Americans. Helen is a licensed clinical psychologist at Stanford University. She is past president of the Asian American Psychological Association and the American Psychological Association Division 45, Society for the Psychological Study of Culture, Ethnicity, and Race. She lives in the San Francisco Bay Area. Hi, Helen. Thanks so much for joining me today.
Great. Thanks for having me, Cassie.
As we begin, I was hoping we could talk about just sort of setting the scene for this conversation. Can you talk about the importance of mental health clinicians being both trauma-informed and culturally responsive?
That's such a great question. I think most clinicians realize how prevalent trauma is in every population, really, across the world. And so there's a lot of awareness about being trauma informed, which is how do we create a healthy, respectful, safe place for people to heal from trauma. What we don't always talk about is the link between being trauma informed and being culturally responsive, having cultural humility, and being actively anti-harm. So, say anti-racist, anti-transness. That part of creating that safe space for our clients is also how we engage with them.
Mm-hmm. I like that anti-harm. I haven't heard that before, but that sounds really important. What is a positive sense of identity, and why is it important, especially for Asian Americans?
hmm We don't always talk about identity as a thing. It's certainly not usually like a goal, especially if you're working with insurance. But identity is sort of this core sense of centered, authentic, healthy sense of who am I, a self. And there's pieces of that that are cultural, religious, family, societal. And it's particularly important. It's been shown in the research to be correlated positive identity with a positive sense of mental health well-being and with resilience when inevitably difficult things will happen. So positive identity helps us cope and feel healthier. And it's especially relevant for Asian Americans who have sort of a mixed identity. We could be fifth generation Americans, we could be recent immigrants, we could be refugees, children of refugees. And because Asian Americans have actively been excluded, the only ethnic group, for example, that actually had a specific law to exclude them. And then terrible things such as Japanese American internment. There's just a lot of shame and trauma around Asian American histories that can really impair a healthy sense of identity development.
Yeah, and I have to imagine that microaggressions, racism, all of those things, stereotypes are really hard not to internalize as like that sense of identity as well.
A lot of clients will say they feel really confused and have internalized a lot of negative stereotypes.
Yeah, and in your book you talk a lot about shifting the narrative. Can you give us an example of what that might look like?
hmm Yes, I love the phrase narrative plentitude, which comes from the author Viet Thanh Nguyen. And it's this idea of a healthy, constructive sense of narrative, your story, right? The narrative therapist can definitely talk more about this. And an example of that may be, for example, I work with college students who sometimes feel a sense of imposter syndrome. Am I good enough for this place? Are people going to find out I don't actually know everything that I'm doing? It can be a really difficult, frequent experience internally. And plenitude may be expanding the story of like not only you're good enough, you excel because of, say, maybe your hardships, you actually are even more qualified than others. Or sometimes learning about history, like for some of my Asian American students, finding out all the ways that Asian Americans have contributed to the United States for literally hundreds of years, and many of them didn't know that, helps to have this narrative sense of belonging. I think young people now talk about having main character energy, right? It's really realizing like you can be the center of your own story, and that's also part of the externalizing of unhelpful, maybe stereotyping narratives.
Yeah, I really like that. And I have to imagine that like you mentioned, a lot of Asian Americans will have sort of these dual identities. And I have to imagine that's really challenging of feeling not enough of either of those things or too much of either of those identities. So I like that idea to shift the narrative and sort of become the center of your story instead of just being not enough or too much of something, right? Like more yourself.
Yeah, and that's such a good point. It can come from multiple sides, right? So it could come from at work, I feel like I have to hide aspects of myself or put on this sort of fake mask. But then maybe even at home, my family may say, "Oh, you're also not enough of this or that," and so learning to center the strengths of actually being multicultural.
Yeah. This is reminding me of past lives a little bit because she immigrates but her friend doesn't, and I think that's just like a really good example of what we're talking about here, and I just was left feeling like that story was just so well done, but it feels like she got some of the essence of that into that story.
Yes, that's really literally right, making her own story, kind of that entering the narrative plenitude of like our cultural understanding of people's stories.
Yeah, yeah. In your book, you share the racial and cultural identity development model. Can you talk about what that is?
Yes, it's hard to cram folks like sort of intersectional identities into a model, but it is helpful if someone has never really actively thought about identity as being something you can look at with perspective. And so a model is helpful. So the racial and cultural identity model helps people think about maybe what stages I'm in. And it was conformity, dissonance, resistance, immersion, introspection, ultimately, sort of an integrative place of being able to integrate all aspects of identity. And so that's just been a helpful way to frame and outline how we talk about identity and also normalize that it's okay to move. It's not sort of a just a linear progression, that at different phases in life, our identities shift. Maybe where we're working, if we're having a family, all these things where we're living. But that is a place to kind of talk about, maybe moving from a place of feeling imposter phenomenon to a place of maybe sometimes being angry and divisive or unsure where you belong, and then hopefully ultimately ending up in an integrative place.
Yeah. And you talk a lot about values in the book. What role do values play in sort of the healing from trauma process?
Ultimately, we want people to feel whole again. And values is actually something that seems very intangible, but it's such a grounding phenomenon, right? It's how does someone reclaim their sense of how do you live in a way that's ego congruent, that is fulfilling, sort of the meaning there. We sometimes have people who are very high functioning but are extremely psychologically unhealthy, unhappy. And I think a lot of that sometimes is not feeling like they're living in a way that suits their values. Also, as therapists, being mindful that we're not maybe inadvertently or accidentally imposing our values. So I think a lot of our role is helping folks discover and explore what are the values, those guiding principles of what matters most in their lives. And again, for a bicultural, multicultural person, that might be confusing because you've got multiple sets there that are all very important.
How do you work when you feel like maybe two of your values are clashing?
A lot of life is really about modulation, whether that's our mood modulation or how we make our choices. A really common example, say with Asian Americans, is feeling family loyalty versus maybe my independence and what seems healthier for me. And I always say we can explore that it's not like a hard, you have all boundaries, you cut folks off, you don't do anything. There's a way to explore maybe pacing. There are certain points where I need to assert things, and there are certain points that it's healthy and value congruent for me to compromise and to actually have a place to be able to discuss these things and make intentional choices instead of feeling pushed by various forces, be that familiar or social.
Yeah, and what does it look like? Like, let's say family is an important value. What does it look like to sort of put that in practice and live that value?
It's figuring out how do you have self compassion, protect your sense of identity and value, while still loving others. We often, the shorthand I talk with clients is like, well, boundaries are where I can still care and love for you, but also for me. Right. And one of the reframes we talk about where Asian American clients will frequently say, maybe my mainstream therapist or friends are like, oh, you just do whatever you want. You're an adult. They can't tell you what to do. But my cultural values are like, you should always be respectful and you should take care of them. And where's the middle ground of that? And I think it is possible to build an internal, personally tailored compass of sometimes perhaps say my family will be really upset at me for this choice, but I also know that taking care of me is also an investment in taking care of my community and my family. Reinforcing things that might not be healthy is not actually how I care for my family. So I am still upholding family values, maybe not in the exact format that my family would prefer, but sort of figuring out those ways we can create that middle ground.
Yeah, it feels like it really is focusing on like a self-awareness. Like that's what I like about values work is you have to be self-aware to sort of align how you're living with those values.
Yeah. And we have those great like value worksheets and things like that are available now. There is some of that in my workbook as well. And it's striking how rarely we make time to talk about values in modern life.
Yeah, yeah, and it's funny because like the type A in me wants to be like, I'm all of these values, but it's not about like collecting values. It's just more about being more intentional.
Hmm.
A piece of your book that I really liked is you don't leave out the body, right? The body is an important piece in healing, and you call it the body mind. Can you talk about what that is and why it's important to look at them as one?
Yes. There are a lot of cultures that do use terms that basically mean body, mind, like no space, just one a whole being. And, I mentioned the book, like the whole Descartes, like the mind body problem. For a lot of us in Asian heritage culture, that's never been a problem. It's just sort of understood that you can't have one without the other. They are different, but they are absolutely connected in every way. And be it different cultural influences or capitalism or just all these things, we're kind of currently living in a contemporary society where a lot of people feel cut off. That so much work in every theory of health and therapy now really seems to have to work really hard to get people to be mindful and just be present. In high pressure places, I'm in Silicon Valley, I'm at Stanford University, where there's a whole joke that like people see you as like a brain on a stick, not as a person whose body has needs and pleasures and pain, and you have all these other facets to your personality as a person. So we're literally and figuratively bonded as one, and many would also say spirit is also in there. And it often comes up in the therapy room because there are some people who are just so unable to attune to their bodies that they don't realize even maybe how stressed they are or how their trauma is affecting them until the somatic symptoms really force them to put on the brakes and look at what's happening.
Yeah, and by the time it gets to your body, it's pretty late in that process of what's been sort of, festering back there. Like I feel like the only time I have ever been more present in my body and realized it was when I was really sick. Like it gets to that point, which is just such a shame because it is such a, like you said, a very connected body mind.
Yes, I've
Yeah.
been there.
Yep, yep. I think they say like take time off or your body will take it off for you or something like that when you're working too hard.
Eventually.
Yeah, like burnout. And one thing that you talk about in your book is the impact of cumulative trauma. Can you talk about what that is and the impact it has?
Yeah, that sometimes there's a idea that trauma is like one thing that happens and then that's what you're healing from and then everything will naturally be fine. That's rarely the case, right? There's cumulative trauma. What we realize now, there's first of all intergenerational, right? Things that have happened even before we were born, but that impact us. I mean, I can't be an expert in getting off into the epigenetics of that piece, but even just the way you were parented or the society that you grew up in has been impacted by intergenerational things. Just talk to anyone who is the child or grandchild of say, Holocaust survivors or refugees from somewhere, and there are clear impacts through generations. And then you add on top of that whatever may have happened in your own life. That may be a known trauma, like, oh, I had a horrible car accident, I was a victim of a crime, or I've been harassed in some way. But then there's also ongoing traumas of, am I experiencing microaggressions? Am I having to be hyper alert all the time for my safety? Right, during the pandemic, with the escalation of AAPI hate, there was just so many Asian Americans who felt, and Annie Saw and her team have great research about this, just the unease and the hyper alertness. That's a different kind of trauma that's ongoing. And then the ways that these can kind of become cumulative and ball up. So maybe I already had some intergenerational trauma. My parents were survivors of, say, war. And then now I'm feeling hyper alert, even just going to the grocery store, and then trying to make sense of all that. It's really quite a lot.
Yeah, and it feels like your body just would constantly be in fight or flight.
A lot of research, primarily so far done on African Americans, has talked about this idea of weathering, that this constant hypervigilance and concern that you're going to be microaggressed or you're being harassed on such a frequent basis just sort of wears you down in terms of your psychological energies.
When we're talking about intergenerational trauma, is intergenerational trauma always going to be something that is at the forefront, I guess, or can we, as we move forward in generations, sort of break the pattern of that?
I suppose defining how we break intergenerational trauma is not entirely clear. I do feel that in many ways, when we work to heal ourselves and future generations and community wide, that is healing intergenerational trauma. Yeah, there's lots of people who think about ancestors as kind of also being present, and we can get on a whole tangent, but there's a Blackfeet Nation version, the original version of the pyramid that later became adapted into Maslow's hierarchy. But in the Blackfeet version, the idea was that the peak of life was not just self actualization, it was cultural perpetuity. It was giving something beyond your own lifetime, having a positive influence beyond. And so I think there are many who feel now that their work to decolonize and heal, shame and bridge gaps within the community, that is healing of a generation. My Indigenous colleagues have been widely using the term survivance. And so I think that's really about that post traumatic growth.
We'll be right back after this short break.
I'm Dr. Lindsay Gibson, author of Adult Children of Emotionally Immature Parents. Growing up with emotionally immature parents can affect their adult children in several ways. Most of all, it affects the child's ability to trust themselves as adults and to see themselves as people of value who have healthy entitlements to respect and their own individuality. So join me on this adventure of self-discovery. For more details, go to adultchildrencourse.com.
New Harbinger online courses, self-help for everyone. A concept you talk about is wise thinking. How can someone develop this?
I'd like to think of it as that sweet spot between emotional and rational thinking. So it's not becoming like so clinical and removed, and because our emotions have. I always tell people, don't be scared of your emotions. They have data, right? They're telling you something. When we say we have a gut sense or reaction. However, our emotions can also, especially when we have trauma, be kind of off. And so cultivating that like wise thinking is, where is the sweet spot between my emotional wisdom and my rational thinking? So much of it is about being able to attune to those things and be present, which is really hard with trauma histories when we may tend to be triggered really rapidly. So a lot of the mindfulness practices are about bringing ourselves back to here in the body mind what is happening, rationally exploring instead of feeling like we fall into our automatic habits or triggers.
Yeah, and you're mentioning triggers. What are some other things that trauma survivors might experience, and how can that wise thinking sort of help regulate it back?
I mean, people talk about feeling easily triggered emotionally and physically, right? That it can happen before we even have a thought. There are the ways of how trauma impacts our interpersonal relationships, our body mind things like physical agitation, sleep disturbances. So, a simple example of using wise thinking in that moment is sort of being able to even realize, like, oh, let's say my stomach is roiling and I'm feeling a little agitated, and to be able to take that moment to maybe do my breathing exercise and say, what's happening? Or before it might be like I would just go in a cascade of panic. Something's wrong. Maybe I'm sick, or oh my gosh, this place, they don't want me here. And just going down that cascade of negative thoughts, where being able to sometimes pause and notice, like, instead of feeling badly that my stomach is doing this, like, gratitude for my body, like, what are you trying to tell me? What's happening? That is this that's going on. I think right now a lot of people on my campus are talking about the second Inside Out movie that anxiety is there and nobody wants anxiety, but then anxiety is just trying to help you or protect you. So understanding what's happening so that you could be a little more intentional of how you respond this time, as opposed to always falling into the habit, which may have been positive to begin with. It might have been a survival skill, but maybe now in this situation, which doesn't call for this reaction, it's not helpful.
Yeah, I love that you brought up Inside Out too. On this season of the podcast, every interview I've been like, "Have you seen Inside Out too?" Because it's like as somebody with anxiety, it is the best portrayal of how anxiety spirals. And I left and I had like a tear, and I was just like so thankful for my anxiety for trying to help me. And you get more compassion for those emotions that are really just there to try to serve a purpose, even if it's not helpful, of course.
It's totally functional. And I've talked to so many people, yeah, who've said things like getting judgy about themselves, like, oh, I thought I like beat this anxiety thing and it's coming up again and I failed. And I'm like, whoa, like, all of our health maintenance is lifelong, right? It's, you haven't failed, you're just going through a rough spot. Just like I have to constantly work to keep my body healthy. It's not like I did it once and I'm done. Same thing for managing our anxiety, what have you. Like, it's an ongoing process. And yeah, and not to be angry or ashamed about the anxiety, but just sort of like, okay, what are you trying to do here? And like, maybe today we need you, maybe these other 10 times we really don't.
Yeah. I like that you mentioned the how you work constantly on your body. I've never heard it put that way, but that makes so much sense. Like it's not like you eat a salad and you're suddenly just forever healthy. Like that makes so much sense. And I think it puts it into a whole different perspective of managing sort of your emotions.
Yeah, we're really judgy about
Yes.
our mental health for some reason,
Yeah, for sure. And I want to go back just a little bit to intergenerational trauma. And I want to, like, since there is sort of more conversation about it, can you talk about why intergenerational trauma is especially harmful and how does it show up in everyday life?
I think one of the aspects that makes intergenerational trauma so difficult, it's like not even being able to name the problem. A lot of, for example, children of, say, refugees will talk about growing up with a sense of fear or worry, and yet not even being able to name what it is. And so, all the more likely it can develop into this giant free floating anxiety or free floating comprehensive sense of shame or worry. So, it's like that. Well, the psychodynamic people, right, they used to have talk about the ghost in the nursery, right? But it's sort of this ghost or the shadow of trauma, but not even being able to identify what's going on is really difficult. And then not having the story, because so many survivors don't talk about or struggle to talk about what's happened. And, the victors of war always sort of oppress stories. And so many people don't know the stories. And so it's hard to build that narrative or that identity about, like, this is what happened to us, this is what we survived. Instead, it just feels like there's something wrong. The world is unsafe. Don't know what that's about. And a big shame is I feel all these incredibly resilient people who have survived all sorts of things aren't able to share their stories of resilience and survivance, and how, there's incredible wisdom that they possess.
Yeah, I was gonna say, I think, like, isn't it true that a lot of people just don't talk about what happened to them and then they're sort of holding that to themselves and their mind and their body, which has to be particularly harmful as well.
Yes. And the way that they cope as best as they can. And as we all know, we have constructive and very not constructive coping mechanisms. And so how that snowballs as well, like perhaps intergenerational trauma has now also resulted in, say, substance abuse.
Yeah. And what you said is, I think, just the key point there is that it feels like something's wrong, but you can't name it. So you can't necessarily seek out help for it if you can't name what's wrong. It just feels like a full wrongness in your body and your mind.
Yeah. And as we all know, especially with children, the tendency then is to conclude that the problem must be me.
Yeah. Oh yeah. Yeah. That's a heavy weight to bear. A piece of work that you talk about are mantras. Can you talk about why these are important and what these can look like?
A lot of our work in therapy is trying to sort of dismantle the really harmful negative self-talk that so many of us have all the time. And I often talk with folks about, if you think about how many hundreds or thousands of times you may have said really mean things to yourself. Oh my God, what an idiot. Or, mantras are really having to explicitly start to balance that ratio of what is the encouraging, more balanced, maybe more helpful thoughts, and practicing those repeatedly. And it often feels kind of awkward initially, but it can grow into a regular practice, right? And to become aware of the ways that our negative talk often is something that we repeat a lot. And how do we actually, with intention, find what is the healthier mantra or saying or perspective?
This feels like it goes along with, cultivating a positive self identity. But what does it mean for someone to embrace ancestral pride, and why can this be so powerful?
If a mantra is a small kind of affirmation and reminder, right, the ultimate bigger goal is actually reclaiming pride and wisdom. Um, it's deepening that connection too between ourself and something bigger than ourselves. And again, that's something that has often been damaged more for people who had to immigrate or become refugees, is that wonderful sense of like tie and connection we've had maybe was lost or obscured. And how do we reclaim that? But that also includes reclaiming. So, for example, for a lot of people who came here as immigrants, like myself, maybe we didn't have any positive role models at all. And learning more about history and realizing you're part of something bigger and realizing that there's so much wisdom that can be used and shared, but it's also incredibly healing. For example, a lot of BIPOC therapists will talk about being trained in a way that was like, oh, all the best psychological thought and theorists were all mysteriously Western educated, elite, cis het men. And of course, there's many other kinds of wisdom. I had talked about a study just a few years ago that said something like more than 80% of the world's population doesn't even exist in our literature, our psychology literature in English. So reclaiming that wisdom is connecting to like, hey, actually, it's not that I'm trying so hard to become, say, an American or fit in here and everything else in the past was not good. It's understanding now that actually maybe my ancestors knew these practices for thousands of years and I'm a part of that. And how do I use that? So connectedness is not just individual connectedness. The Surgeon General talks a lot about the loneliness epidemic, which is real, but there's also that family, community, and like wider, deeper through time connection too, to realize that we're all a part of.
Yeah, I like that in the broader sense of connecting with, your historical ancestors, but also you mentioned community in the present day. What role does that play in healing?
Certainly, community is a source of support, and it's often a source of purpose and meaning as well. And also, that community can be multiple things, that it's okay if we have multiple communities for different needs. I think sometimes folks will feel like, if I can't get all my needs met in this one community, something's wrong with me. I have to contort myself to fit here. And maybe it's just we can broaden our sense of communities and not try to get all our needs met from one person or one community. But it's a mutual aid kind of feeling, which is incredibly important for people to feel like support, but also feel like you have a role amongst others as well.
Yeah, that's so important. I think that's a good place for us to wrap up, unless you have any final thoughts for our listeners.
No, it's such a great opportunity to talk about some of these issues. I think remembering that fundamentally lifelong learning and humility is the way to go, not only in our work, but in life, right? That, as we'd said earlier, sometimes things that worked really well for our health or coping at an earlier stage in life is maybe not working now. And so we have to constantly sort of add to our toolbox and approach things with humility. And maybe the equanimity part is also to be okay with that I think in this achievement oriented society, people can get really like, I'm supposed to know this, or I should hide it if I don't know, where humility is a lot about just sitting with, yeah, I don't do everything right. I don't know all the things, but I can make a commitment to lifelong learning and working to foster respectful environments where we can all heal.
I love that. We're all just works in progress. Thank you so much, Helen, for joining me today. Thanks for doing this important work and, providing this really important resource for people. And I know they're going to get a lot from reading your book.
Thanks so much.
If you're an Asian American who has experienced racial violence, verbal harassment, stereotyping, or microaggressions, you might feel like the world is unsafe. You may suffer from anxiety, depression, or painful memories as a result of this trauma. And if you seek help, you may find that Western trained mental health professionals simply can't understand your pain and life experiences. This book provides culturally informed treatment methods to help you heal from and fortify yourself against race based trauma, including intergenerational and historical trauma and stress. Written by an Asian American psychologist, this workbook blends contemporary psychology with ancient mind body approaches to help you build resilience in the face of racism, overcome trauma and internalized oppression, reclaim your mental health, and celebrate your heritage. Using skills grounded in culturally informed cognitive behavioral therapy, acceptance and commitment therapy, and somatic practices from Asian cultures, you'll learn to create a healthy identity, balance your emotions, cultivate a growth mindset, and increase a feeling of connection with your community. You'll also discover tools to help you manage negative thoughts and feelings, identify your values, build resilience in the face of stress, improve relationships, and foster healing in your community. If you're in search of mental health and wellness tools that respect, understand, and honor your experiences and cultural values, let this workbook guide you on your journey to heal the pain of racial trauma so that you can practice empowerment and reclaim the life you deserve. Visit our website at www.newharbinger.com and use coupon code podcast25 to receive 25% off your entire order. New Harbinger Publications is an independent, employee-owned publisher of books on psychology, health, spirituality, and personal growth. For over 50 years, our evidence-based self-help books and pioneering workbooks have helped readers make positive changes to improve mental health and well-being. Founded by psychologists Matthew McKay and Patrick Fanning, New Harbinger is proud to be an employee-owned company. Our books reflect our core values of integrity, sustainability, compassion, and trust. Written by leaders in the field and recommended by therapists worldwide, New Harbinger books are practical, accessible, and provide real tools for real change. Join the New Harbinger Clinicians Club, a free membership club exclusively for mental health professionals. Sign up today and you'll receive a special welcome gift, 35% off all professional books, free client resources, free ebooks throughout the year, access to private sales, a subscription to our Quick Tips for Therapists email program, and more. Visit newharbinger.com/clinicians-club for more information. Do you have an idea for another episode? Do you want to send us a message? Our email address is podcast@newharbinger.com. We'd love to hear from you. This podcast was edited by Jesse Fancushion. If you enjoyed today's episode, we'd love if you rated, reviewed, and subscribed to the show, and we hope that you might share it with anyone who could benefit from the content. This podcast is not a substitute for counseling with a licensed provider.